guys, this is Dr. Law Kim, and today I had a question from Brian, who asked me about why he has some hip pain when he's squatting. Why does he have hip pain when he's going down into a sitting position? So now we'll go over a few tips as to how to get that hip flexor to relax. It involves a lot of different components. You want to neurologically reset that tone of the muscle. You want to get that psoas to release. You want to get that hip joint to be mobilized to be able to move forward so you can go into that sitting position, that squat position, without that complaint of pain. So the first thing we'll do is we'll do a psoas release. Now, the psoas is a stabilizer of the lumbar spine. It's also responsible for that hip flex movement. So we want to get that neurological tone down. So how do we do that? We release it. With your finger pads, you want to go about 2 inches away from the belly button. So if it's the right hip flexor, you're going to the right. If it's the left, you're going to go to the left. Use your finger pads, place it 2 inches away, and dig deep. Breathe in and out through your stomach or diaphragm. And do this a good 10 to 20 times. Get a good 5-second breath in and out. And that's just going to reset that neurological tone. You're not exactly lengthening the muscle, but at least your brain is perceiving that there's a reset in how tight that muscle should be. So you'll follow that up with a hip joint mobilization, which you can do in a half kneel position. So you're going to bring your right foot in front if we're working on the left hip. Now with this position, you're going to drive that right knee forward, and that's going to be able to lengthen that left hip joint. With your left hand, you can hook just underneath your butt and push that joint forward. Also, you want to maintain proper spine mechanics. So you want to maintain that deep, nice core position, and you can do that by just sucking in your belly button. Now you're going to do this mobilization about a good 20 to 30 times. And that, again, will help to relax that psoas muscle as well as help with that joint mobility. Now that you've got the hip flexor relaxed, now that you got the hip joint relaxed, you want to add some stability to that muscle group. So a reason why you have that hip tightness, it's not just because you're sitting down all day. It's also because there's inherent weakness. Now, the weakness can be coming from the core, overall core stability, or it actually happens many times due to the fact that there's just some underlying weakness in that hip flexor muscle. So we want to add both components as part of a program to get you back to where you need to be. So the first part, just get some good core stability. There's so many different drills. Let me just demonstrate the most basic one, the plank. So again, going to the floor, I'm going to go in a sphinx position on my forearms, legs out, keep that stomach tight, and then from this position, hold that neutral spine, back flat, push through your elbows to activate your other core muscles of the shoulder, and then hold that position anywhere from 30 seconds to 60 seconds. It's going to be a different challenge for anybody, but you don't want to feel any stiffness in the back. You don't want to feel that hip flexor tightening as you do it. So that's just to get a little bit of core stability. Next, even though you have a tight muscle and you think if you work that muscle, it's going to get even tighter, that's not the case. We reset the neurological tone. We got that joint moving. We got some of that core stability back. Now let's strengthen that hip flexor so it doesn't perceive that it's under threat, so it doesn't perceive that it needs to tighten up, because we're going to have it be stronger. So here's an exercise to work on improving that strength. Now you can get any of these little bands, resistance bands. These are good because they fit the foot pretty well. And again, you can perform this in a laying down position. So lying down, bring the band wrapped around the feet, Again, you're going down into a lying down position. Maintain your core, neutral spine, keeping this tight. And then with your feet pointed towards you, you're going to drive that foot and knee up to 90 and relax down. Repeat on the other side. Foot and hip and knee to 90 and relax down. And you're going to repeat this anywhere between 3 sets, 2 sets, 8 to 10 repetitions. Again, you don't want it to overfire, but you also want to give it enough load where you're actually strengthening that muscle group. Okay, now that we went over an exercise to strengthen the hip flexor, we want to be able to use that strength in a pattern that mimics what is actually bothering you. So what we can do is we can do a lunge technique, which will actually actively lengthen that muscle while strengthening that hip flexor to be in a longer state. And we're going to add another component to, again, even further relax that area. So what you can do is perform this in standing. I'm going to show you this view. So again, if we're talking about left-sided hip flexor tightness, we're going to come into this position. We're going to do a backward lunge with a twist. So up tall, bring that left leg back, drop that left knee straight to the floor. Keep your spine, core tight, back upright, chest up. Get down to this position. And then from this position, you want to twist. Now you can also add that with your arms to get an even bigger neurological reset. Muscle fascial lengthening all the way from the toe up through the hip flexor and all the way up and down the chain by performing a lunge, twist, arms overhead, all the way over, and you're going to feel a deep, deep stretch all the way from here to the quad, to the hip flexor, to the oblique, all the way up to the latissimus, and that will really help to lengthen that hip. Lastly, most people complain of that groin pain, that hip pain when they're sitting. So it's sitting and squatting. Same movement. So you're performing a squat. Now a lot of people have really poor squat mechanics. They'll do anything from bending their knees, bending their back. It looks something like this. People with hip pain. They'll go into that position, they'll have that crunching, that pain, that tightness through there. What do? You want to perform it where you don't feel that. So after doing all this, all those other muscles should be activated. What are you going to do to get that better? We're going to do the squat. Find a wall. Lay on it. Bring your feet forward. Keep the core tight. Go down to a sitting position, about 90 degrees. And then the key part is when you come up, you want to activate your glutes. Activate your glutes. The wall is going to help you because it's maintaining that proper spinal alignment. It's not allowing you to shift forward. If you're shifting forward, then you would have that pain again in that hip. Since it's controlled, you're able to maintain that proper alignment and relationship. And then as you come up, you're working those opposite antagonistic muscles, the glutes, to fire up and take over, which will get you to activate properly and which will get you to have pain-free with sitting, with squatting, and lunging. Try those and let me know how it goes for you. And if you have any other questions, just ask.